Welcome back. Joining me this morning, Dr. Lisa Coppa Breslauer, MD, specializing in general and cosmetic dermatology, and she's head of the Laser and Skin Institute in Chatham, New Jersey. We're taking your calls at 973-267-WMTR, and we left off with Lisa from Chatham. Same name, Lisa.
Oh, hi. Thank you for taking my call. I'm in my 70s, Dr. Coppa, and I really need help with the wrinkles. Besides Botox, what else would you possibly recommend, and would I need a prescription?
Again, I'm going to speak in generalities because I haven't met you, but there's many, many different ways to address aging skin. You can start with things as simple as a prescription of Retin-A, sunscreen. Everybody who's concerned about lines and wrinkles and skin cancer should be using sunscreen every day. There are glycolic acids. So there's many different topicals. You can use topical antioxidants such as vitamin C, Retin-A, glycolic acid. And then if you wanted to move into more of the procedural dermatology, there are chemical peels, which can go from something as simple as you walk in and walk out and nobody knows anything was done to something that's a little bit more downtime where you may have a little bit of peeling and flaking for a few days. There's Botox, which addresses pretty much just the forehead and the crow's feet. There are filling agents such as Juvederm, Radius, Restylane, Perlane, which will help to plump up those little lines and wrinkles that we get around our mouth and around our chin. So there's
what did you call that again? Excuse me?
Fillers, filling agents. They help to replace natural fat loss or volume loss in our face.
Oh, that's fantastic. I really appreciate that. Also, I have puffs on the top of my eyelids that are really quite noticeable. They're white. They're puffy. It's not underneath the eyes. It's over. And what do you recommend for that?
Well, is it the entire eyelid, or you have just...
Yeah, it's the eyelids. They're puffy. Maybe it's an allergy to something, maybe, possibly.
It's possible. It's also just possible that it's the way your face is changing with time, and some people do get a little bit of extra skin or some laxity in their upper eyelids.
I see.
A very, very easy temporary measure, it's not going to give you any long-term change, is brew some tea. Take those tea bags, stick them in the refrigerator, and then when you're feeling kind of puffy, use those cold tea bags on your eyelids, because the cool temperature as well as the caffeine will help constrict the blood vessels and help the lymphatics drain, and they'll look less puffy temporarily.
Oh, that is wonderful. Thank you so much. Really
You're
appreciate all the information.
Okay, thank you for the call. Good advice.
Thank you.
Thank you. And we are going to Betty from Morristown. Betty?
Yeah, hi, Julie.
Hello.
I have a question for the doctor.
Okay.
I've been, I guess, stuck, or I've inherited all these little brown spots, and I don't know what you call them, but I would like them removed. They're not exactly moles, but I found that my family has them, and I was wondering, what do you call them? They're brown.
Well, can I just ask you a question, Betty, first? Where are they located? Are they on your face or on your body?
No, they're on my body.
On your body. And are they flat, or do they have some substance? You can feel them.
Some of them are flat, and some of them are a little raised.
Okay, just based on what you're saying, my assumption is that you probably have a mix of two different things. You probably have what we call lentigines, which are freckles from the sun, and you probably also have seborrheic keratoses, which are these benign overgrowths of skin, and they do tend to run in families.
Yes.
Depending on which ones you want to have removed, they can be lasered off, they can be frozen, they can be scraped. There's a number of different ways to remove them.
Okay. That sounds great. Yeah, they're all on the body, and parts of the body I've never had exposed to the sun, so I think a lot of this is hereditary.
Exactly.
Well, you should visit the Laser and Skin Institute in Chatham, New Jersey, and it's Dr. Lisa Coppa Breslauer. She is fantastic. We thank you for the call.
Thank you. Bye-bye.
And I'm going to go through just a couple of these myths, not many, but myth 1, a sunburn does more damage than a suntan. Wow. Really?
Wow. Yes, exactly. Most people assume that if they get a tan that they're safe, and the answer is no, you're not. Tanning is actually your body's way of trying to protect itself from getting excessive sun exposure. So it's developing more and more pigment to protect the cells from dying off. If the body cannot develop that pigment quickly enough, then the cells die and immediately, and you get a sunburn. So a suntan is actually damage to the skin just as much as a sunburn is.
So why were we told we all looked like you can't be tan enough or rich enough or whatever?
Coco Chanel, she made it popular.
And it just sounds horrific when you think about it. I hope the next generation does not sunbathe. Myth 2, it takes years for the effects of the sun to show up.
Yes and no. As far as skin cancers and precancerous lesions, it can take time because the damage is done and it's set in place, and then it could take a decade or so to see these lesions develop. However, freckles, broken blood vessels, textural changes in the skin, that can take weeks to months to develop after intense sun exposure.
Okay, our time is coming to a close. You are fascinating. We're going to have you back, and we'll go through some more of those myths and so much more. I just didn't even touch on everything I wanted to go through. Just very quickly, moisturizer. How important is it?
If your skin is dry, it's important to moisturize it, absolutely. But if your skin is not dry, or if you have patches which are oily, you don't need to moisturize areas that are oily. The moisturizer is just trying to replace what the body's not naturally making.
Okay, and then that one caller called about Botox. Is how common is that? Do a lot of people come in for Botox?
Yes.
You're not telling.
I'm not telling,
talking.
but it's common.
Really? Okay. And how old do they usually? I mean, how old is the typical person?
In my practice, I have women anywhere from their late 20s all the way up into their early 70s getting Botox on a regular basis.
Wow. I'm coming in. It sounds great. Well, thank you so much for a fascinating show. And again, I'll have to have you back very soon. Give us your website, or do you have, what information can you give, or your phone number?
Absolutely. We're located at 417 Main Street in Chatham. Our phone number is 973-635-5050. And my husband does a fantastic job with our website. It's www.lsinj.com. That's LaserSkinInstituteNewJersey.com. And I would love for any and all of you to come in.
Thank you, Dr. Lisa Coppa Breslauer.
Thank you for having me, Julie. It's always a pleasure.
I'm Julie Briggs. Stay tuned for your New Jersey Connection. Next, we'll be right back.